My name is Kushaba Lowin, the founder of Lymphedema Warriors Association. Our association organized 2 medical camps, which started on September 3rd to the 6th of September. That was our first medical camp in Bugema Hospital. At Bugema Hospital, we had a very successful camp, and we want to thank all the patients that came through. And I also want to thank my team for helping us, for doing a lot of work with patients, encouraging them, teaching them the management procedures. And today, as we talk, we are in Rukunyu Hospital, Rukunyu General Hospital in Kamwenge, and we are going to have our second medical camp. So as we speak, our patients have already gathered in the tent. A few patients have gathered in the tent, and we are going to assess, take measurements, and our surgeon from German, Professor Tiha Aoun, and the team are going to choose those ones that will qualify for the surgeries, and those that won't qualify for the surgeries will keep on management. They will manage their lymphedema without surgical treatment. Come with me as we join to the Rukunyu General Hospital. So as we are heading to the tent, our team of the medical surgeons from Germany have headed to check the theater and to see what is missing and what they can do for the patients that are going to be operated. So let's head to the tent. As we head to the tent, we are going to talk to a few patients. The 3 patients we transported from Kamwenge to Bugema because we needed enough time for managing them. But I'm glad enough most of them have gotten an improvement on their legs. Most of their leg size has decreased, and their wound care management has been good, and they're improving. So they're going to tell you more about how they feel and the changes they've gotten in at Bugema Hospital. But all the 3 are just from Kamwenge district. These are the few people that have gathered that have lymphedema, and let's first begin with the success stories for the days we have been with them at Bugema Hospital. So let's begin with our first patient here.
Amabara nibanyeta Mugabe Nebukadineza Bala.
Hati Ogunu Omwe, this is one of our patients that we received at Bugema Hospital from Kamwenge, so that we needed, like I've explained before, we needed enough time to help him we help him with wound care and teaching him how to manage his lymphedema through bandaging. So I'm going to ask him a few questions. And hati ntwenda ogambira abantu ko kuhura treatment ko gifonere ko kutwarizo mberebena bitwe tukwine Bugema Hospital.
Ubwire nkagenda Bugema Balaza na rugayo Balaza bayire mazire y'ebirobino baitu ubwire bumazire Bugema treatment babemba nkoraho ebire nungi kagenda ni nsasa takubyama tagwejagera baitu bwahati nimbyama nigwejagera okuguru kubaye kuzimbire
danje ninye twamusima hinidi kurugera Busiriba kuko urugera kuko bantereka para kunjaja abo bugwere tugireyo kuko munjajabire mpurira nyangu yigwe nchirire kandi kuko mutwegesize ngo kuko tunaba tukisiba tukanaba tukiyonza twabikora ndamanya turaza kugira turakira nejo mpaho nje genda manya.
Our second lead says she was taught personal hygiene, and she was taught how to bandage and to live with the condition. She was empowered, encouraged, and now we have the sister we are going to teach, so that they keep encouraging her, they keep helping her to do the bandaging, because our patients need caretakers in this process, because without a caretaker you can't do anything, because she has her arm and she's still learning how to do the bandaging. So we are also going to teach her caretaker to do her bandaging, because she's one of the patients that qualify for the surgery. We don't have enough time. We are trying to teach the caretaker on how to do the finger bandaging, because also her fingers are swollen too, so we need a little pressure on them. Then we pull the skin layer. We are going to start with our foam padding here. It protects the skin. And foam padding protecting the skin. Atataho bandage skin. Nabanza haka kenda kacheke tukweta ka skin layer. Then nayongera haka farisaka. Then atekaho bandage gy'ekyakashatu. Konka mwine kumu buyonjo mulebe mpira ebintu nobyozya. Ebyo ebintu depends okwoza noreba ko kwano oine kumakinga sure nti no by'omuyonjo waba ukozesa ebiro bibiri kyende ekyo kyakashatu obe noyozya otekeho ekindi. Now what we are doing is we are putting the foam paddings that also are a bit of that are adding a little pressure to the arm. We bandage from where the swelling starts from and where it ends. So bandaging zikiza kutandika twakutandisa akasiiwa murebe ubona noguma nomufaho watandikira omu tokumwimata munonga kumumaraho emirembe wareba wakoma ekintu okamuriita munonga nakushasha takuza kukoraki kubugumyaho. Natwe abantu sibo bure tukwendaga amaizi gatambulire kikumanyisa nti omuntu oine kumuriita kubura obusinge. Right now we are doing the bandaging, but I was explaining to the caretaker not to make it so tight that it's uncomfortable, because when we are bandaging, the goal is to reduce the size of the arm and to be comfortable. Once you feel any pain, then you know you've done it wrongly. You just have to redo everything. Hati utwakoma nogaruka moji kwa toti oyongeserezaho. Konke kwa ruguru kuba mizi ndagarugo oko gambuka oko hata haiguru tamurita munonga kora harita nigazankai tugine gakuza sonotine kumurita munongo oko kurita kwitu kutandikira hakonka kutari kushaka kwambuza obusinge wambuza obusinge akashasha nono ma wakureba ugwire ukashire ko nareba hempinduka hinduka. Ejuni joint toine kushanga wajirita munonga kubashira kwa asa kufunya mukono gwe tigwine kugangara nk'ekiti. Hata hatwamheza hatwaheza twena kikichukira tutekeho okantu kashe bukwate bushe konka kubuyinja. We shall have to improvise, or she will get tape, what we call salt tape. Basabwe salt tape omuduuka wamara kubiteekayo obukwaseje ubone kubiteeka ha mukono. Hata kakugati jino mazono leki salt tape orebe nti wabukwasaho bereme kurugaho konka ine kugenda kanaba mukamugazeho ebintu byiwe. Ninchakare tukwatagane wamwine therapy ndize barindiriye na package yanye barindiriye twine okushoma tekukwayo kuba byo tugamba yomwe namanya okamanya amagezo nigahwayo na twine kwega oguna yegera mugenzi we konka natwayega mwine kuteka yo buryo bwo kwega ekintu nooba oruwenka omu maka gaawe waba okubundamira oburwire, it is you okuteekamu amaani tiitwe kuba nanye bakanjanjaba konka tinkiri n'abajungu ndi aha bwange, so nkeega nanye ndimu nenkyekora, nanye nembasubura munimwe mukyege mukyekorere ninga olina omuntu nk'ogu okwiza n'ogu amuyambe, n'ekindi mwemanyi mukwatagane buli omu agume nayeyusya mugenzi we ekyokukora. I was still telling them that they need to work together, like she has come with a caretaker. They need to keep doing it because 95% is for the patient, because they have to learn how to do it by themselves. I was telling them that I was in German, I learned, and right now I'm not in the hospital. I'm doing my own self-management because I had to do what it takes for me to learn. So I'm also telling them and encouraging them to know one another, like a lymphy group, lymphedema support group, like encouraging one another, because it's not the end. We all need each other, yeah, and we shall keep encouraging one another. Nature meeting at Busiriba, because okwega tekukwayo. So tomorrow we are meeting at Busiriba, still in Kamwenge district, where we are going to meet more patients and have a good day.
Thank you. Thank you very much.
Hello, we are now at our final destination, which is Busiriba Healthy Center 2 in Kamwenge district. This is the most affected area in Kamwenge, where most victims of lymphedema, which we call pondoconiosis, the one they contract from the volcanic soils that contain minerals of silicon and lithium that penetrate into their skin, causing blockages in the lymphatic system or the obstruction in the lymphatic system. We have just headed here right now, and all of them were super excited to see us the second time, because we're here in June and we assessed a few patients, and today the number has increased. So I'm going to talk to them. We are going to first apologize for coming late. However, we had to first go through the DHO's office to the district. We had to go to Busiriba. We had to go to Rukunyu Healthy Center, where we had to see also a few patients that had gathered there. Finally, we are at our final destination, where many patients of lymphedema are. Nanyina obushashi bumwine nanyembwine konka turi hamwe tinkwenda mugira okutiina tuhamire hamwe tukwatagane hamwe konka ekikuru munonga n'okwisya buli omwe aguma ayesye mugenzi we ekyokukora twizire omu gwa mukaaga twabagambira tukarebaho bake nende ba faces ensya konka bamwe nembamanya abamwe ninkwamanya erizooba hati erizooba twikiriza kitwagambira omu gwa mukaaga nti abashaho nibakwija abajungu baturebe. Egi niyo ntandikwa yitu ey'oburwire bwitu, tekuza kugyenda erizooba, tekuza kugyenda nyenkyakare, konka ekikuru n'okumanya ekyokukora n'oburwire bwitu. Right now we have Mr. Everest Diayanga, who's a coordinator, a volunteer of lymphedema patients here in Kamwenge for a long time. Before we go ahead, I want to thank you so much for helping the lymphedema patients. They all confide in you, they run to you, and thanks for helping them and coordinating them. We are here because of you, because if you didn't coordinate these people, we wouldn't be here.
Sure.
Yeah, so
Thanks.
you can tell us more what
Yeah.
you've gone through, the challenges you're facing here.
My name is Ambeanga Everest. I'm from Busiriba LC1, Busiriba LC2, Busiriba Sub-County, Kamwenge District. Here, where we are standing, we are the people who found that we have elephantiasis. We started in 2011 identifying that we have patients of podoconiosis. Because of not getting services from the government and the other sides, where we made a research and we got more than 100 patients. They came on accumulating. As of now, we have almost 1,000 within the Kamwenge district. And following the research, the majority are the women. And when women are too much affected, that country or that village or district will not develop. So we appreciate the kind people or well-wishers like this NGO who has promised. You can see even our patients now they have hope that they will get cured or their pains will be reduced. We thank you so much, the director of this organization. You can see even they have started smiling, and even the entire community and the district at large. Thanks very much.
So before we end, Mr. Beanga Everest wanted to know some of the challenges you're facing while coordinating these patients, because since they come from different areas, what are some of the challenges you've faced?
Yeah, as a person and as a coordinator, I am a volunteer. I am a citizen who has done this because I am also affected by this case. Now, the challenges I have faced in this process, people were neglected at first. People couldn't join the others. They didn't even want to see them. And again, others are stigmatized, like younger generation who are affected. They fear to come out and speak out that they are affected. That their lovers will leave them, both sides, like girls and boys. They are somehow stigmatized. And another challenge which we have, we don't have funds to help them. So once we call them, they think we are bringing soap. And the ministry recommended them to wash at least 3 days in a day with the soap, with salt. So it's a challenge. Once you call them or when you visit them, they expect those things. So we have many challenges, and some, at least a big number, has died, and that is a challenge also. They die there in their respective villages because of not getting treatment. Sometimes they fear even to visit the health units. They die there. And because of they have a lot of pain once they are affected like by fever, immediately they die. Yeah. So we have lost many patients, more than 45 when we started this initiative. So challenges are many, as we have been asking even our bosses. And we informed the country, we informed our leaders, they know. Yeah. Then like here, the challenge we have, we don't have water. We don't have water, even if you can look around, even at the health facility. And this disease needs to wash many times in a day, in a week. So once you don't have water, you can't control it, as you will be seeing when you are treating. Yeah, there are so many people have lost their people. They have left orphans. We have even widows because of this disease, and I think that is also a challenge. Yeah. Anyway, and many others.
Thank you so much, Mr. Everest Biayanga.
Yeah.
Being lymphedema is a tropical neglected disease. Most people are abandoned. The stigma in this area, like Mr. Beyanga said, especially for the youth that are contracting the condition, which is pondoconiosis. But remember, it's also a lymphedema because there is an obstruction in the lymphatic system, so there's a blockage. So meaning the legs or the limbs are going to swell up. So we are here basically to give them hope, because lymphedema is curable, but it is manageable, because treatment at the end of the day, you have to manage your condition. So let's head to the center and we can start our activities.
Bandaging.
Ine namba ye? Nongambe namba yano, mami.
Ali muchikeso omusajja egifomu neyambanga olususulweye etekola ka pressure na bandage zireme kumwoza.
This is our second day of the medical camp at Busiriba Hospital. So we have been teaching our patients to do skin care and hygiene mainly, because right now all of them are done washing their feet and their legs. And the next thing is skin care products, because we all know that skin care is very important, because moisturizing of the skin is very important to lymphedema patients, being that it's among the CDT, which is a complete decongestive therapy for all lymphes. And we want to thank Movit for sponsoring our camp and giving people knowing that skincare is really important to patients having lymphedema. Skincare products from Movit, the herbal jelly and the Skin Guard antibacterial soap, which we are going to give to our patients because it's going to help them with cracked skin, dry skin, and also we have provided the Kelvin solution so that it's an antiseptic solution for their skin and legs, because we all know lymphedema patients, especially in this area, most of them do not have they are poor at hygiene. So that's why we told them to first wash their feet. We use this solution, and also they use the skin guard soap to wash their feet, and lastly they have to apply the jelly onto their skin. Thank you so much, Movit, for sponsoring us, for knowing that lymphs need skin care, because moisturizing is part of the therapy. Being that the CDT, this is the third step of the therapy. So right now we are going to keep encouraging them and telling them how to use the products on their skin, because it's key. Thank you so much. Shitago kwesiga waheza kunaaba olebe nti wasiga skin mugireberere, kuba skin mwa mutagireberire neza aho kibakweta ko yayomangatana niko kutunga ebironda. Omuntu weena nagakwako at least banomanya nti nyine kuguma nensiga skin yanje amashita, waguma ogirekire yayomangatana mutunga ebironda beta infection. Na towels, making sure nti omuntu guba hakatawera ako okozyeje waheza kunaba ebigere olebe nti ombugerejere omu mbukumukumu noyiyamu amiizi ago otasiga amiizi omu bigere. Bw'okusigamu amiizi omu bigere olwala infection ejja kwetera kushanga ebigere byanunka. Mushemere kuba nimwomya ebigere, tukuuma obuyonjo, obulire bwite bukwenda abantu babarofa, waba oburofa nibukubundamira. Omuntu weena ayine kuba ali omuyonjo. So we are trying to tell our patients that they have to wash their legs and especially the whole body. They are supposed to be clean, because we really love hygiene is really important to all people, not only lymphedema patients. And I was trying to tell them that towels we have given them, every time after showering they have to make sure they dry up their feet very well, because we have problems of fungi. Most of them have fungi and their feet are smelly, so we are trying to teach them on how to dry their feet and moisturize their skin. Yeah, as we are ending our lymphedema medical camp, I want to thank the DHO, the LC5, the LC1 chairman here. I also want to thank the Lymphedema Warriors team. We also want to thank all the patients that have participated on this camp, especially the women. We are grateful the women are trying, but the men when it comes to hygiene, they were way worse than the women. So as we are ending our medical camp, we have taught them to do self-care. Especially the whole thing was about hygiene, because in this specific area, Busiriba Center 3, we are trying to teach them, because most of them are the most affected. It's the biggest part in Kamwenge that is affected with lymphedema, pondoconiosis. So we have taught them self-management care that comes with hygiene, skin care. But like we have promised that we do not have enough bandages, we shall be coming back with more bandages, because most of them need compression garments on their legs. We want to thank also our sponsors, Movit, that have helped us to give us the skin care products like soap, the jelly, and also I want to thank the lymphedema team that also provided them with sanitary towels and antiseptic soap with oil that they are going to use for their skin care. Mainly we are doing the skin care session here so that we teach them what to do so that they moisturize their skins and they have a happy skin and to reduce infection. Those that can come through, please come and help us. We need more donations to help people in Kamwenge, not only Kamwenge, but the whole Uganda, because lymphedema is one of the conditions that is not talked about, that is neglected. So we need people to come out, the government, to assist people that are living with lymphedema, because they need the care, because they feel lonely, no one to run to. And in hospitals, we know very well there are no our facilities, and this is a time we need to stand up as Ugandans to help these people to have at least management for lymphedema, and also build hospitals, orient our doctors, teach our doctors, all the healthcare professionals to know what lymphedema is and how to take care of lymphedema. As the Lymphedema Warriors Association, we are doing very good. Right now we are doing management. We are teaching people to do self-management at this point, and we have a lot of success stories, and we have surgeries that have already been done so far in Kampala, and right now we're having a surgery at Rukunyo Hospital, one today and one tomorrow. So as we end our camp today, we are going to keep coming back, and not only ending the camp today, it's just the beginning. We have just started the whole entire project of lymphedema patients in Uganda.